Warning, censorship. Warning, censorship. Warning, censorship.
But what's Alberta's excuse? Here, watch this.
I'm announcing today that starting tomorrow, we'll be putting in new targeted COVID-19 measures in place to help protect the health system and to drive cases down. I know that many people don't want to see additional measures. And I know that we're all tired of this pandemic and are desperate to just move on. Where needed, we will implement a curfew where case rates are significantly high, specifically if cases are 1,000 or more per 100,000 population, and in cases where the municipal government requests it. These restrictions are so that are in target areas where cases are highest. If your community is not seeing high levels of spread, you won't see change. And I know that it's been a long road. I know many people will not want to take another step in this direction of more stringency, but we must. AHS and law enforcement will continue taking enforcement and issuing fines for non-compliance. And to ensure Albertans take these fines seriously, we are adding additional backstops with stronger fine collection and actions with restrictions at registry services. So that means if you are given a fine and you're not taking it seriously, you don't pay it, you will not be able to, for example, renew your driver's license, and there will be other implications with respect to registry services. These fines won't affect the majority of folks who are following the rules and are doing their part to keep our communities safe. Rather, this is for the people who aren't taking the pandemic seriously and continue to put others at risk by not following the public health orders in place.
A lot in there. I dispute completely the assertion that nobody wants this. That's patently false. Not everyone is tired by this. That's just wrong. There are a lot of people, too many people, who are absolutely having the time of their lives. The public health deep state is running the show. Anonymous bureaucrats you never heard of or voted for a year and a half ago are now unrestrained tyrants on TV every night. Parliaments are shut down or slowed down. Courts shut down or slowed down. But these little dictators, these public health officers, they say and do what they like. And it's like commands sent down from Mount Olympus. They love the celebrity too. I mean, I found this incredible. But BC's public health officer, Bonnie Henry, she actually took a few hundred hours off from this emergency to write a self-serving book to cash in on her celebrity status. Imagine that. That is so gross. The lockdownists love it. The vaccine companies love it. They're making billions. The big tech giants love it. Each new variant of this disease is a new opportunity for a new product line, a third jab, maybe a fourth. That's not speculation. We showed you the other day. That's part of Pfizer's investor pitch these days. But is it really so bad in Alberta that it does demand a curfew? I don't know, you be the judge. Here's a graph taken from Alberta Health's own statistics page. The death rate, the number of deaths per day, it was high in January, February, but it's plunged to what, a quarter of that level? I think just one person died yesterday. I know it's sad when anyone dies, but people do die. But why would there be curfews now when things actually are so much lower, so much better than just a few months ago? The hospitalization rate, there are 151 people in intensive care units around Alberta from the virus. That's not good, but Alberta has 106 hospitals with thousands of beds. 106 hospitals, 151 people in intensive care. So not quite each patient having a hospital to themselves, but pretty close for ICU patients. But think about curfews. I no longer have the good fortune of having my own grandparents around, but in their golden years, the thing about grandparents, at least when they're in their 80s and 90s especially, is that they go to bed a little earlier than young people do, and they actually don't go out quite as much. You don't see a lot of people in their 80s and 90s just tearing up the clubs at 1 a.m. on a Saturday night. And that's how all the victims of this disease are. No one in Alberta under 20 has died. No one. In fact, in the past 14 months, out of a population of 4.5 million people, a grand total of 129 people under the age of 60 have died cumulatively in Alberta from the virus in over a year. 129 people. whereas 1,294 people over 80 have. In fact, the average age of death is 81. And this is even more important. Of those who have died, 97% had a serious pre-existing health condition, like cancer, heart disease, stroke, dementia. In fact, 76% of people who died from the virus had 3 or more. So back to this curfew business. If the average person who is passing away from this virus is 81, and the average victim had not 1, not 2, but 3 or more very serious underlying health conditions, are any of these people really out and about after 8 p.m. just on the streets of the city? Are they really? You might see people in their 80s out and about at night. But if they also had dementia and diabetes and cancer or stroke, I'm sorry, I just don't think that's who's out at night, grabbing a midnight snack at the 24-hour diner, or I don't know, going to a late movie. I just don't think that's who's out at night. So why a curfew? Why punish the young and the healthy? That's who's out at night. And punish is the word. Did you hear that part about the registries? That's like license registries where you get driver's license. Again, lots of people in their 90s don't actually even drive anymore, but people in their teens, 20s, and 30s sure do. They need to go to work, to go to school. The healthy need driver's license. They will be punished now. And the worst part of all this is that Jason Kenney is giving that power to the abusive, virtue-signaling mayors around Alberta. The leftists, Naheed Nenshi and Don Ivesons of the world. They're awful. The government of Alberta put out this website announcing their new brutal plans. And let me quote some excerpts. This is from the Premier. "We have no choice but to implement these targeted measures." Yeah, no, you do, actually. No other place in North America has a curfew other than Quebec. It's bizarre to say you have no choice. You are still the chooser, right? You still are the decider, right? Or is it someone else? Here's what the health minister has to say. "No one person or community is to blame, but the evidence is showing that certain areas are experiencing significantly higher spread." Well, actually, a curfew punishes the young, especially the poor. It does single people out for a disease that targets people in their 80s, 90s, and 100s. Why the bizarre focus on people who just aren't involved? And this is from the unelected health tyrant herself. "But if we can muster the strength to make it through these next few weeks." Really, you're still saying that line, eh? Just a couple weeks. Just 2 weeks till we flatten the curve. Just a few weeks on this second wave now. Just a few weeks on these new variants. Just a few weeks on this curfew. Just a few weeks. It's just a few years now. Does anyone believe them anymore? Do they believe themselves? Look at this. "While schools remain a safe place and are not a main driver of community spread, in order to limit in-person interactions, all junior and senior high school students, grades 7 and above, will shift to online learning." Okay, you just said they're not where the disease is. You just admitted there's no science behind it, but you'll do it anyways. What? "All indoor fitness activities are prohibited." Okay, good. Good. Just stay home and watch Netflix and order in fast food and don't get exercise and don't stay healthy. I say, are there a lot of 90-year-olds going to gyms and yoga studios and playing team sports in Alberta? Or is this just being especially punitive? Now, I'm not being hostile to people in their 80s and 90s. I'm saying, if you care about them, why are you punishing young people? Why are you talking about curfews on young people? How on earth does that help anyone, including people in their 80s and 90s? This is such a disgrace. That's an excerpt from my daily show, the Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.